Good evening, everyone. This is a virtual stakeholders meeting that we're holding. The City of Bowie is holding. My name is Joe Meinert. I'm the City of Bowie Planning Director, and I will help to facilitate the meeting, particularly the questions and answers section of the meeting. This is a detailed site plan review, which involves the Encompass Health Company and their physical therapy rehabilitation center at Melford. A couple of points that I'd like to make just in terms of participating. The attendees are in the listen only mode, and we would encourage you at the appropriate time to use the question and answer function in Zoom to ask your questions, and we'll try to answer all of those questions as they come through. We do not work with raised hands, so only use the question and answer function and not the raised hand function. This meeting is being recorded, and the invitees only are the ones who are participating, and only those people who are registered. So it's not an open public meeting, but we are recording it, and we'll post the recording on the city's website on the project page. And so at this point in the meeting, I'd like to turn it over to Frank Stevens, who is our senior planner, to do the staff presentation.
Thank you, Joe. Good evening, everyone. This is a stakeholders meeting for the Encompass Health detailed site plan application in Melford. I'm just going to quickly go over the area that we're talking about for this detailed site plan. I'd like to focus your attention on this map of the Melford development. US 5301 is to the south, running east-west here, over to the west, to the right. Or to the
Joe, Frank, I'm sorry, we're not seeing anything.
Oh, sorry about that.
Sorry, Frank.
Let's see.
Frank, hit share your screen at the bottom.
Okay. All right.
There we go.
Is that better?
Yes,
Yeah.
thank you.
Okay, thanks for bringing that to my attention. Okay, so this is the Melford development. The site we're talking about is in this shaded area here. Melford Boulevard comes in from the west in this alignment. This lot 1 is the recently opened Thrive Assisted Living Facility. The 911 call center is here. Melford Boulevard extends in this direction and intersects with Marconi Drive here. This is a little closer up view of the area and the site in particular, which is located here. Marconi Drive is over to here, and Melford Boulevard runs along the front. Here's the 911 call center, and the Thrive Assisted Living Facilities is up here. A little closer look is the site itself. The building footprint is this kind of L-shaped building with parking, on-site parking around the perimeter of the building and site. Marconi Drive is over here, and Melford Boulevard is up here. Lastly, this is the same view with the landscaping proposed throughout the site. It's a 6.5 acre site. The building is 1 story, 61,800 square feet with 60 beds. The city's hearings are as follows. Bowie Advisory Planning Board on Tuesday, October 13th at 7. City Council Monday, October 19th at 8 o'clock. Both of those meetings will be for, virtual public hearings. That concludes our opening presentation. Now I'm going to turn everything over to Matt Tedesco.
Thank you, Frank. I appreciate it. I'm going to share my screen with everyone. Give me 1 second. Can everyone see that?
Yes.
Okay, thank you. Frank, thank you again so much. Joe, appreciate your comments as well at the beginning. For the record, for all those who are attending, and unfortunately I can't see the attendee list. I understand there are a few people in the attendee list, so hopefully you can hear and see our presentation. We're very, very excited to be with you all this evening for the stakeholders meeting. I do want to take a brief minute to just introduce the panelists who we have with us this evening. On behalf of Encompass Health, we have John Shuden. He is the Director of Design and Construction. We also have David Bickle with Soltez. They're the civil engineers of record. Mike Lenhart, I believe he's joining us if he hasn't already. He is with Lenhart Traffic Consulting. He is the traffic engineer on the project. And we have Joe Ferris from Frederick Architecture, who's on with us as well. In addition, we have our good friends from St. John's Properties joining us, Mr. Andrew Roud, Mr. Ken Finley, and their legal counsel, Mr. Robert Antonetti. So we want to thank them for joining us. Obviously, we know that the Melford project as a whole has a long history, and we've asked them to join us this evening in case there are any overall questions that may arise as it relates to this particular development project within the Melford community. As Frank indicated, the subject property is in the southeastern portion of the overall Melford property. It is subdivided. It does enjoy a detailed site plan approval on the property. We are in for an amendment to that detailed site plan to accommodate the Encompass Health inpatient rehabilitation facility. So we provided this initial slide just to orient everyone again to where it is actually within Melford. For those that can see it, we have Maryland 50 to the bottom of the page or the south, Route 3 to the west or to the left, and the proposed Encompass Health inpatient rehabilitation facility is at the kind of the lower right-hand corner of the slide. We have a few slides just to make sure everyone is familiarized and understands what is actually proposed with respect to the Encompass Health. So we wanted to provide this information, and if needed, we can certainly provide Mr. Stevens with this PowerPoint presentation, and feel free, and he can disseminate it or share it with anybody who may want it. But some of the the takeaways from this particular screen: Encompass is the nation's largest owner and operator of inpatient rehabilitation facilities in the country. There's some statistical information on here we thought would be useful. Currently, as of the end of last year, December 31st of 2019, there are 133 we call IRFs, which are just short for inpatient rehabilitation facility, within 33 states, including Puerto Rico. They employ over 31,000 employees and have a combined $3.5 billion in revenue. As of the end of last year, there was 186,800 inpatient discharges. There's also some information on this slide with respect to home health and hospice, but John, correct me if I'm wrong, I don't believe the home health and hospice is proposed with this one.
That is correct, and it will not be at this location. That is a separate entity that if it came to the area, would have a separate location completely.
Right, so we're just focused, this facility is just focused on the inpatient rehabilitation. So to hit some of the higher points, and again, we wanted to make sure that we informed everybody what Encompass Health and what an inpatient rehabilitation facility is, and even more so what it's not. So this slide provides some of that fairly specific information in kind of a more user-friendly format. As I mentioned, Encompass is the leading provider of post-acute medical services and is the nation's largest owner and operator of inpatient rehabilitation facilities. They treat patients who have undergone treatment for acute medical events such as strokes, spinal cord injuries, neurological conditions, amputations, lower extremity fractures, or joint replacements. Following treatment, the need for short-term intensive physical rehabilitation prior to patients' return to the communities and their homes. And I want to highlight that's what they do, and I want to highlight what they're not. Encompass's IRF, or this proposed IRF, is not a comprehensive, does not offer comprehensive inpatient services such as surgical or diagnostic services. They do not operate emergency departments, and they do not provide drug or alcohol or mental health rehabilitative services. Generally speaking, and more often than not, patients that arrive at this facility will arrive by a non-emergency transport vehicle. The patient undergoes evaluation to ensure that the patient is medically stable and is capable of participating in intensive therapy. On average, the age of the patients are 71 years of age, and no walk-in patients are permitted. The average stay for any patient is 13 days. The next slide is just a breakdown of just the percentages of common diagnoses with respect to the patients that are treated at the facility. You can see neurological is the highest percentage at 21%, stroke 18.5%, disability and impairments is 11%, and it goes down the list. We've provided this slide to just highlight the IRF's care providers and services within the facilities. We have rehabilitation physicians, rehabilitation nurses, physical therapists, occupational therapists, speech language therapists, respiratory therapists, case managers, and the post-discharge services. For this particular development within the Melford community, the initial phase 1 of construction would include 60 private rooms. The total building size is approximately 62,000 square feet. Our goal is to break ground March of next year, 2021, with a grand opening in May of 2022. The initial development costs are expected to be $47 million. This slide, we just wanted to highlight some recently newly constructed facilities throughout the country. 2 in Texas, 1 in Myrtle Beach, South Carolina, and 1 in Boise. As far as the facility internal, we wanted to include some representative slides of the internal facilities. So what we have in this presentation slide is the sample therapy gym, which is the top left corner where my cursor is. We've got what we call an ADL, the daily living room suite, with a kitchenette and cooktop and oven. Certainly we have the reception lobby, nicely accentuated with lighting and building materials and things to highlight the high-end nature of the reception area, and then the nurses station. This slide shows is a sample patient room. Again, all these rooms are private. Obviously, the facilities are all handicap accessible, and to make the patient stay that much easier as they rehabilitate from whatever services they're having performed. The final, close to the final slide, is a sample of the dining room and outside grounds. I think these kind of speak for themselves, but we wanted to kind of just bring everyone inside the facility to give you a better understanding and experience of what is proposed. This slide is what we refer to as a rendered site plan. You can see the building is an L shape. We show that in kind of a blue and light blue color. Parking surrounding, a significant number of handicap accessible parking and van accessible parking for obvious reasons, right around the main entrance, which is right here with the porte-cochere as you come in. These slides, and if we need to dive deeper into the architecture, and I know Joe will do a much better job of explaining some of the building elevations and architecture, but for the most part, the building material is brick. We have metal coping, metal screens, and aluminum panels. So these are just the different elevations. The elevation A is looking at the front of the building. You've got the main entrance to the left of the screen with the longer leg of the L facing the Boulevard. Elevation B is what would be the right-hand side of the building, or the northeastern elevation. You can see the main entrance here. Elevation C is really the back of the building. This elevation back here, which is the southern elevation. And then elevation D is the other side, or the southwestern side of the building. This is a three-dimensional view of the building that's proposed. Generally, that's proposed. Some of the building material is slightly different from this slide, but this is one that we've used in another presentation that most closely resembles a 3D rendered elevation of the building. So we want to include that. It gives you a nice perspective of the entry and the main entrance. So with that, that's our presentation. Hopefully I didn't go through that too quickly. Again, we have the full assembled team with us tonight, including representatives, as I mentioned, of St. John's property. So if there's any questions that we can answer, we're here to do that. So I thank you for your time and the opportunity to present.
Thank you, Matt. This is Joe Meinert again, the city's planning director, and I see we do have two attendees who are on the meeting tonight, and I'd encourage you, if you have questions, to use the question and answer function at the bottom of the screen in Zoom to type your questions in, and then I could read the questions and we can have whoever is necessary answer the questions. And so we'll give you a few moments to collect your thoughts and write up some questions in the Q&A. So we'll stand by for a moment. Okay, I'm not seeing any questions from our two. So I haven't heard any questions come in from the participants, and so I'd like to ask Frank Stevens to just reiterate the hearing dates that we have and how people can participate further.
Sure, thanks, Joe. Again, the city's hearing dates are Bowie Advisory Planning Board on Tuesday, October 13th at 7, Bowie City Council Monday, October 19th at 8 o'clock. Both of those meetings will be virtual public hearings.
We look forward to attending, and Frank, as always, if you need anything or if any questions may come in after the fact, please don't hesitate to reach out to us and we'll get you responses as needed. And as far as this presentation, let me know if it's not in your inbox from a day or two ago, and I'll be happy to resend it.
Okay, thank you, Matt. I'll go and check.
Yep, it was pretty large, so it may have gotten kicked and I just didn't get a message. So if I need to, I can send it in a different format, but just let me know. We're happy to do that. And I appreciate everyone's time. I appreciate our attendees and our panelists for joining us this evening. And with that, I think we're ready to go.
Yes, sir. Thank you all for attending. And with that, we will end the meeting.
All right. Thanks, everyone.
Thank you.
Thank you.
Thank you.
All righty.
Bye-bye.